Adult Fala, the Human Body, Day 76. The Locomotor System, Musculoskeletal System, page 147. The Abdominal Wall. The muscles of the abdominal wall are divided according to their location into straight, oblique, and deep abdominal muscles. The oblique muscles are arranged in three layers, and their aponeurosis anteriorly form a sheath that encloses the rectus abdominis and serves it as a guiding channel. The rectus abdominis has several tendons separating multiple bellies and runs from the superior border of pubis lateral to the symphysis upward to the insertion of the ribs into sternum. Of the oblique muscles, the external oblique runs superficially from the lateral portions of the lower ribs obliquely forward to the iliac crest and to the rectus sheath. The internal oblique runs in the layer deep to this, its fibers running almost at right angles to the external oblique. Its aponeurosis also fuses with the rectus sheath. The innermost layer is formed by the transversus abdominis. The psoas major and the quadratus lumborum muscles, together with the lumbar spine, form the posterior abdominal wall. The muscles of the abdominal wall, together with their aponeurosis, form a functionally entity in that they exert their pull in different directions, forming an oblique support. The arrangement of the abdominal musculature allow rotation, flexion, and lateral inclination of the trunk. At the same time, the abdominal muscles act to exert pressure on the abdominal contents and so assist the emptying of the urinary bladder at the rectum. They also take part in expiration by raising the diaphragm. The diaphragm. The dome-shaped diaphragm is the most important muscle of respiration and separates the abdominal from thoracic cavity in the form of a musculotendinous partition. The muscle arises in a ring from the inferior thoracic outlet. Its muscle fibers arch upward and radiate into a central tendon. According to its various origins, the diaphragm is divided into a costal part, a lumbar part, and a sternal part. The inferior vena cava runs through an opening in the central tendon. The aorta and the esophagus enter the abdominal cavity from the thorax through two slit-like openings in the lumbar part. In life, the shape and position of the diaphragm change with breathing, posture, and body position, and the degree of fullness of the inner organs. When the diaphragm contracts, the thoracic cavity enlarges and thereby supports inspiration. In the relaxed state with simultaneous contraction of the abdominal muscles, the diaphragm rises, which leads to expiration. Each displacement of the diaphragm has an effect on the abdominal organs. For instance, in the inferior border of the liver descends with inspiration and rises again on expiration. In the erect posture, the left dome of the diaphragm projects to the upper border of the fifth rib during maximal expiration, while the right dome rises a little higher to the level of the fourth intercostal space. During maximal inspiration, the two domes descend by about 3 to 6 centimeters.